And you're
Hey guys, thanks for tuning in here today. This month we are promoting heart health, and if you haven't checked it out yet, Dr. Bizon also has a video with respect to how chiropractic helps with the overall health of your heart. And my portion is going to be actually on the nutritional component that we educate and teach our patients on when it comes to heart health. Heart disease is like the #1 killer in industrialized nations right now. There's over 500,000 people that die a year from heart disease, and what's startling is that half of those people, so 250,000, die as a result of a sudden death. And by that I mean they had no symptoms of heart problems. Their first symptom was that they died. So it's a pretty serious condition, and it's something that we really try to focus and educate our patients on. Most public places nowadays, it's such an important thing. If you go like on an airplane, go to schools, gyms, anywhere like that, they'll have what are called AEDs, which are automatic electronic defibrillators. And they are little machines that are designed to basically revive your heart if you suffer some kind of coronary infarct. Key players in coronary heart disease, are going to be diet and exercise, and that's two of the things that we combine with pretty much any treatment plan we give anyone. The key points with diet are going to be things like decreasing your saturated fats, decreasing trans fats, decreasing partially hydrogenated oils. Another big player is excess calories. If you gain weight, if you're overweight, you're going to be that's a risk factor. Another big player is grains. Okay, that's your breads, your pastas, your cereals. In excess, they can also be a player in this whole scenario. Just changing your diet, like the Journal of the American Medical Association just recently published a study saying that low-fat diets just by themselves, that's not going to be enough to decrease your chances and your risks of heart disease. So the solution becomes a multifaceted solution. You're going to need many things. Things like avoiding foods that are or increasing the non-hydrolyzed, unsaturated fatty acids. Okay, that's the foods that are higher in sources like omega-3s. That should be your primary fat source. Whole grains. Okay, using whole grains as your source of grains and your main source of carbohydrates is a very important way to do it. Increasing your fruit, increasing your vegetable intake. I always tell my kids, as you know, I have 3 small children, and I continuously stress to them that if they don't have a fruit or a vegetable on their plate, then it's not a meal. So these are great things to look at. When it comes to supplements, there are some key supplements that are involved in the equation. A lot of you have heard me talk about it before, but the omega-3s, that's your fish oils, your EPA, DHA, the actual 2 components that we're looking for in the fish oil. Supplementing with those is essential. Another supplement that you may want to look at too is coenzyme Q10. That's pretty important too. And the British Medical Journal and the American Heart Association also stress the importance of taking those supplements. And I think right now, for healthy people, not for people with problems, but for healthy people, they recommend a minimum of 1,000 grams or 1 gram per day, 1,000 milligrams per day of your EPA DHA. And so that's a baseline. If you have any kind of problems or risk factors in your family, then that's only going to go up from that point. Another thing that comes into the equation is going to be exercise, regular exercise, not just working out for a certain time, but continuous regular exercise. Not smoking is a big factor. Taking that out of the equation really increases or decreases your chances. Maintaining your healthy weight, as I said earlier, is extremely important as well. When it comes to diet, there are different things. Again, one question I get a lot from people is about a vegetarian diet, which is a good diet. The problem with vegetarian diet is sometimes you'll get increased trans fatty acids and increased refined carbohydrates. And those are 2 of the foods that actually increase your risk of heart disease. So that would be one of the areas that you have to watch if you are on a vegetarian diet. When it comes to cooking, there's studies out there now on the effects of different ways we cook our food. A big misconception for a lot of people is the safety of margarine. Okay, margarine is worse for your heart than regular butter. Another one that is important too is olive oil. If you cook with olive oil, it actually increases the chances and the efficiency at how the omega-3s that you supplement get into the cell membranes, which makes them more effective. So those are some of the big things. Another thing that they use now a lot in the medical field is monitoring your homocysteine levels. And homocysteine levels, as they go up, will increase your chances of heart disease. The Journal of the American Medical Association recommends that to decrease those homocysteine levels, you want to increase things like folic acid, vitamin B12, and vitamin B6. Anyway, hopefully that gives you a handful of key hints and points, some direction for you with nutrition when it comes to heart health. For the details of how many grams of omega-3s, how much coenzyme Q10, folic acid, B vitamins, and things like that you would need to take, please feel free to call us and come in and we can help you with that based on your age, your sex, and things like that. We can determine what's a good ratio for you. You can also get blood work done to determine the amount of omega-3s to omega-6s that you have in your body. The omega-6s are bad. They're the ones that are in the grains. The tests cost anywhere from $120 to $150. And if you'd like to investigate your own ratios more, let us know. The typical ratio that we're looking for of omega-6s to omega-3s, that's the bad to the good, is about 4 to 1 or less. So anyway, I hopefully have given you a little bit of information on that, and if you would like more, please contact our office and we'll be more than happy to give you more details. Thanks, and have a great day.